Life na sense. Now let's be very fast. Last week Friday I couldn't take questions. Last week Friday was supposed to be an open day, so I decided in less than 10 minutes. If you have any questions for me you want to ask, let me just do my best and see if I can respond to you on WhatsApp. The WhatsApp number to send your questions 080 95975805. I take the WhatsApp number again 080 95975805. In case you have any questions for me, you can send them and I'll try to see if I can respond to you. I have about 10 minutes and I have a guest that will be joining me on the program. So send right away. And I always notice something whenever I'm done and out of the studio. I get people say, Doctor, can I call you? I'm sorry, you can't call. I'm sorry, you can't call me. I don't give my contacts.
Doctor, I can pick the call on your behalf.
There's no number to even call. That's the issue. You can't call me because I won't give you. You understand?
Then you pay me monthly for doing that.
Or you book a consultation. Okay, so let's see if I have any number or have any question on WhatsApp, and I will try to respond. Because anytime we're on air, I always get so many questions and I can't respond. So if I don't see your question, I won't be able to respond. Remember, it's first come, first serve. By the way, happy new month. Yeah. Happy new month. Welcome to the month of May. Very wonderful month. A month of blessings. I can't see. Okay. Do we do this? Do we phone lines? Zainab,
yes, Doc.
Should we try the phone? Let's see. Okay, I think I have one question here because of time. Hello, I sometimes have pinching eye. Pinching. What do you mean by pinching eye? Like sharp pain. What could be the cause? Sharp pains. Sometimes I don't know what you do, the nature of your job, maybe, but anybody can have pain. But if you're having the sharp pain in your eyes, you should honestly, you should check it.
Or does it mean itchy eyes?
No, I don't know. It said sharp pain, like sharp pain.
Wow.
Yeah. So if you're having sharp pain in your eyes, sometimes it comes and goes. It might just be your eyes giving you a sign and asking you for you to get it checked. And if there is a need, you check your eyes. They might prescribe an eye drop for you. Most especially when you go for an eye check, they will definitely check what we call the pressure in your eye, your intraocular pressure. So just like the way you have high blood pressure, your eye too has its own pressure. So if you haven't done that, I think you should do so immediately. Yeah, that will be my recommendation for you. I have another question here. Hi, my name is Joy Ikeja. Joy, I would like you to advise on the current trends between consultant pharmacy and medical consultant. What does it mean for the Nigerian population? Okay, medical consultant, these are medical doctors that went for specialist training. Consultant pharmacists are pharmacists that also went for their own specialist training. Full stop. You understand?
Doctor.
Yes.
Can a nurse be doctor? Doctor nurse.
I think there are, but not in Nigeria.
I did have a guest on my show last week, and
yes.
then he said he's currently running his PhD.
Correct. You can, sure.
Son is a nurse.
Yeah, it's very possible.
In nursing.
The only issue we have with some people that have the doctor title, we should just let them know, oh, I'm a doctor of pharmacy, doctor of nursing, doctor of medicine. It's important we let people know. Okay. Good afternoon, doctor. Waist pain is killing me. Please, can fibroid cause that? Because it's not allowing me to empty the bladder, but I don't want surgery. I heard there is injection to shrink it. Yeah, sure. Fibroid can actually cause you waist pain. It can. In addition to that, there are other things that can cause you waist pain. You don't want surgery. You heard injections can shrink. I don't know where you heard that from. There are certain medications that can reduce the size. They are hormonal medications. I think your gynecologist would want to advise you on that. If the fibroid is giving you severe pains like this, and they advise you to get it out, I think that will be the best thing for you to do. That will be the best. That will definitely be the best. But please discuss with your doctor, your gynecologist. And doctor, please give me direct answer. I'm sorry. I'm not a pastor. I'm a medical doctor. I'm sorry. I'm not going to answer you. Please, Yeah. Let's leave that area. Sorry, my guy, no vex. I know where I stand on certain issues. I also believe in God, but okay. Hello, Dr. Fred and Zainab. Please. I have serious headache right now. I would have been on my way to the hospital if not for the rain. Please, could it be because my glasses are weak? Respond. Your glasses are weak. Are they recommended? Sometimes, yeah. You can have issues with your eyes and it could give you headache. If you have been using the glasses for a very long time and you haven't changed it, I think it's the right time to do so. So the answer is yes. It's possible that the cause of your headache might just be from your eyes or something else in addition to the eyes. So I would advise you to do so. Get it checked and maybe change it. Yeah, I've seen they are recommended. No problem. So it's possible. If the hospital is not far from you, you can try to get there today. Yeah. Okay, let me see if I have any more questions. I'm trying to be very fast because of time. Okay. Zainab,
Yes.
were you saying something before?
Yes, doc.
Yeah, what was that?
So, doctor, can poor menstrual period cause a woman not to ovulate? Can that as well lead to a woman not having urge for intimacy?
So, look at the time. You bumbled the questions together. Can poor menstrual period not make a woman ovulate? Abi? So the question should be, is it possible that when a woman has a problem with her menstrual flow, she might also not ovulate?
Right.
You get the point?
Okay.
So I want to try to create a balance here. Some women might not even have any problem with their period. You can see your period and still not ovulate. You can actually see your period and not ovulate. But one crude way to just know if there's something wrong with your ovulation is also your period. If you're having issues with your period, irregular period and the rest, there might also be issues with your ovulation. That was one crude way for, as long as your period is regular and coming well,
right,
there's a very high tendency that you are also ovulating. You understand? So if something is happening to your period flow, happen to your menses, it might also be affecting your ovulation. Now, let me say this quickly. Most women think that it's only when you see the cervical mucus that is when you are ovulating. And it's wrong. So many women are having sleepless nights. Doctor, I didn't see that cervical mucus,
right,
therefore I'm not ovulating. Madam, I beg you in the name of God. It's not true. It's not true, because there are other signs of ovulation. You might not even see that cervical mucus and you will give birth to all the kids you want to give birth to in the world.
Wow. It's
so
possible.
don't make it look like cervical mucus is the gold standard. No, now. Oh, baby, no. I have to stop here because of time. I have to stop here. Maybe we'll continue next week. Maybe. But I have a guest here with me in the studio. We're going on a short break. And then when we come back, we'll listen to our guest. Remember, good life.
Nonsense.
So right back. Don't go anywhere.
Experience a better way to stay connected.
Listen, fellas.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.